Greetings, everyone. Welcome to my oral presentation. This is my oral presentation entitled Music That Heals the Soul, a mental wellness workshop to support mothers with postpartum, peripartum depression by me, Queen. I am an MFT trainee. Thank you for tuning into my workshop and welcome. And here we go. So, this is a little bit about myself. My name is Queen. I am an MFT trainee for the Alameda County Public Health Department, maternal, paternal, and child adolescent healthcare under a subdivision called Blue Skies Mental Wellness Team. I work with mothers struggling with postpartum depression, prenatal depression, and in my practice, I like to incorporate various art modalities to support the mothers with getting out of their heads and into their bodies. I like using different visual arts intervention to help them unpack some of their suppressed emotions. I have found creative ways to infuse solution focused therapy and music as a way to help clients achieve their desired goals. Thank you for tuning in. A little bit about me. So, now in this presentation, I will be going over a few things. I will briefly give information on BIPOC maternal disparities. I will be explaining PPD and the causes and the symptoms. I will share some treatment options, and I will also be presenting on my workshop proposal, my workshop music proposal called Music That Heals the Soul, and sharing a little bit about a session, a sample session of what I would like to share with moms. So here is the presentation on some BIPOC disparities that Black women tend to deal with during pregnancies. So, Black women are 3 times more likely to die from pregnancy-related complications. So, why is that? Black women struggling with several different factors during pregnancy definitely can aid to this. Environmental stressors are definitely one of the reasons, one of the causes why Black women will struggle with different pregnancy related complications. Dealing with high stress in your environment, high stress in your community, high stress within your body. Having access to proper health care, that is a key factor that's important. Having access to proper health care, getting that prenatal care that you need, even getting that health care before pregnancy is important to support with, healthcare issues such as hypertension, obesity, chronic health disease. These issues are something that definitely needs to be addressed either before pregnancy and during pregnancy. And Black women tend to struggle with these disparities in their community, not having access to that. Food insecurities is another one. Not having proper food, not having the adequate food that you need to feed, to sustain yourself, as well as the baby that you're bringing into the world. Financial disparities. I'm sure folks can relate. Not having access to a lot of money or any money to even get access to healthcare and food. These things can plague you during your pregnancy, which aids to the stress. Having mental health disparities already, struggling with depression and anxiety already is something that can intensify during the pregnancy time. So these different disparities are something that will intensify with mom during pregnancy. Sorry, we jumped too soon. These things will, so here we are. These things will be intensified during the pregnancy again, if they are not, treated and looked after. Now, here's a bit of information on PPD, postpartum depression, or peripartum depression, as the DSM classifies it as. The DSM classified it as a mood disorder or depressive disorder, giving it its name peripartum because classifying it under all those sectors. I encourage folks to definitely go into the DSM and look under that information for themselves to get a clear or more extensive detail about what peripartum is and mood disorders and how they affect you during the pregnancies. Now, postpartum depression is more than just a baby blues. And that's a term that's been thrown around through time of baby blues. Mom just has the baby blues. She's had a baby, she's sad, and she's just going through the different ups and downs. And that may be true in some cases, but postpartum depression or peripartum depression is something that happens after birth and it may even be during it. And these depressive disorders can affect a woman's appetite and their insomnia and their sleeping habits, as even having a difficult bonding with the baby. These are concerns that midwives and healthcare professionals tend to look for when they're treating moms with different or assessing moms with depression or any types of mood disorders that they may struggle with. Depression that occurs after childbirth, those who develop postpartum depression are at a greater risk of developing major depressive disorders later on in life. Again, like I said, some symptoms may be insomnia, loss of appetite, intensive irritability, and again, difficulties bonding with the baby. And this going untreated, definitely any longer than a couple months, is something that will intensify throughout the time mom is trying to care for the baby. Here is a fact that I was able to bring up was postpartum depression affects 1 in 8 women. Black women are 1.6 times higher to be affected by PPD other than their white counterparts. Here are also some contributors to postpartum depression and PPD. Again, environmental stressors being a hitting factor on why one will struggle with PPD, depression, postpartum depression. Society norms place a lot of pressures on Black women and Black moms, women of color, to be strong and to handle extreme stress. These things are, the superhero syndrome. You got it. You're so resilient and you're able to just handle anything. You're so strong. And sometimes those societal norms place weigh heavy on moms when they just want to feel loved and cared for just as well as the rest of the world. So having environmental stressors, societal norms placed on moms, especially BIPOC moms, to be the be all of things is something that can aid to and contribute to postpartum depression. Again, with the financial insecurities, not having any money. I mean, just not having any money to provide for anything for yourself or your child is definitely going to be a heavy stress and a factor onto how you move and operate throughout your day. You're, of course, as a mother, mothers definitely want to be concerned, want to know if they're able to provide and buy food and have adequate life for their child. Again, these things can weigh on one's mental stress. Access to cultural competence healthcare is another factor. Being heard by someone who supports you and hears you. Necessarily, we sometimes we don't have access to having um, healthcare providers that tend to look like us when we come into the hospital. So that's a cultural competence that we tend to have to deal with. Not feeling heard or supported by the medical team is a major factor in why these things can contribute, because I can say that I'm hurting or I'm tired, and someone can say the healthcare professional can be so unconsiderate and uncompetent to my stresses by telling me that I'm so strong and you can handle it all. You got this. You're so strong. You're so resilient. And when you just want to be loved on and you just want to be hugged on or heard. Again, having a poor diet and poor exercise, not having access to money to get proper food and proper prenatal nutrition, not being able to have access to have exercise, being in an environment where exercising or moving around is really limited or prohibited. These things can plague, and these are some contributors to PPD. Here are some treatment options for PPD that can be helpful to support moms. Seeking support from healthcare providers. Again, if you have access to having a cultural competent healthcare team, getting that support from that team is very helpful. There's some medication options that you can choose from. And it's important that you definitely speak to your healthcare provider and your healthcare team about those medical options. Having support from your friends or your family, or having a community around you is also a great way to work through this issue. Having a support group, getting in a support group, again, outside of friends and family. If there is some community providing support groups for postpartum depression or prenatal care, it's okay to get into that support group. And getting into therapy. Psychotherapy is also a great way to support for this cause. Getting some therapy, group therapy, or any forms of treatment from a medical or mental health profession. Holistic support, like different forms of holistic healing and treatments like acupuncture or group therapy or art-based therapies, or different forms of um, community treatment that will be able to be accessible is another way that treatment can be an option. These treatments can be an option for postpartum depression. So now here is the meat and potatoes of my presentation, my workshop proposal. And in my workshop proposal, I'm proposing an 8-week therapeutic workshop using hip hop as the framework. I would like to support a group session, having group sessions from 45 minutes to 60 minutes in our work, creating a dyad and triad option for moms to get in community with each other and meet each other and share their stories with each other and share this work with each other, as well as in an overall big group section. I will be using a mixed therapeutic approach by different forms of narrative, CBT, solution focus, solution brief therapy as an option, different forms of EXA approaches through music, using writing and lyric exploration, songs and poetry, beats and vibrations, dance and movements as a way to propose each week's workshop. Can music support with postpartum depression? Music therapy can be helpful to alleviate depression and anxiety with postpartum moms. Music therapy interventions can help eliminate fears and anxiety around delivery. Support Supports with moms bonding with the baby. Share forms of creative expression, ways to share their stories, ways of getting out of their own mind and into their bodies and feeling just the different waves and vibration of how music can speak to their soul and tell a story in a different way than they're normally telling their story. So here's a sample session of the workshop that I would like to propose. So in that session, I will, of course, have a pre-intake form where I will share with clients, their different various of music forms that draw to them and their why. So in that first session of group, I will like to warm folks in with just teaching the moms about how breathing can be a great practice of just really calming your nervous system down by just breathing in and exhaling out. And with that last exhale, definitely making the loudest sound you can possibly make and allowing your body to feel that vibration. So in our bulk of the work that we will be doing in this session, it will be definitely talking about boundaries, setting some rules within the group. By teaching them to set rules in the group is teaching them to set rules within themselves. Sometimes moms are so overwhelmed with so much, and they're overwhelmed with so much because they're taking on so much and putting so much on their plate. So setting boundaries would allow them to know that, what was for my plate is for my plate, and I'm going to take on what I can take on, and I'm going to be firm on my boundaries. So, and then I would like to close out the session by folks having, their list of music and placing it in a jar. And each week we pick out a song to listen to and vibe from and unpack on how it resonated with us or with the moms throughout the group, and see how, they can feel a form of connection to it. So in this session, I would like for moms to, sit back and have some self-reflection on how setting boundaries and how be able to breathe and how be able to just be able to think about how different things can just resonate with them and speak to their soul in this session. The outcome of this workshop, or my goal of this workshop, again, is to allow moms to just self-reflect, just reflect on their wants and their whys of their lives and different aspects of where it is they want to be. I would like to bring awareness to the struggle of the trauma and how that affects their healing. A social and emotional mindfulness on how their thought process and how these emotions affect their healing. I would like to help build connections with bonding with the baby, but building a pathway as well as with their future goals, using this workshop as a way for them to create goals and a plan for their going forward. Here is some information on where I was able to create this presentation. Please check out my references. And I thank you so much for tuning into my orientation. I hope this orientation, I'm sorry, not my orientation, my presentation. I hope that this presentation was helpful for folks to know or have awareness about postpartum depression and some different ways that it can be treated, as well as some holistic options like music being a way to support moms. Thank you again for tuning in, and I appreciate it. Thank you, and have a great day.